Sialolithiasis refer to the formation of salivary gland stones calculi that obstruct the salivary flow. Lifetime prevalence of the symptomatic salivary calculi is about 0.5%. Most commonly affect gland is the submandibular gland because of its long, tortuous duct or alkaline mucin-rich saliva. Less commonly affected glands are parotid, sublingual, and minor salivary glands. Clinically, there is intermittent swelling of the gland associated with pain, tenderness, and sometimes leading to sialadenitis. Most of the submandibular calculi are the radiopaque, seen on the plain X-ray, while 10% are the radiolucent. Reverse is true for the parotid gland. Most of the parotid calculi are the radiolucent, not seen on the X-ray. Imaging modalities are plain radiograph. It is the first line investigation which detects most of the radiopaque stones. Ultrasound. It's useful for the smaller calculi. CT scan. Highly sensitive and it can see 3D view of the stone. MR sialography. It is very specific and sensitive test. If you see T2 weighted non-invasive, it can detect the ductal anatomy and pathology without any contrast. So most effective test for me is the MR sialography. So it can detect anatomical as well as pathological lesions. Conventional sialography almost obsolete because of its contrast injection is very painful and it is invasive and operator dependent technique carries risk 10 to 15% failure rate, so there will be a small risk of ductal trauma is also there and sometimes may lead to acute sialodenitis. That's why conventional sialography most of the time is not recommended. Management mainly conservative like hydration, sialogogue, massage or NSAID for the pain management. Minimally invasive technique like transoral small excision retrieval of the stone or sialoendoscopic retrieval of the stone. Surgery is indicated on the repeated or recurrent sialodenitis cases which is because of calculus. Then you have to remove the source of the stone formation, means you have to remove the submandibular gland. So this repeated infection required aggressive surgical management, that is gland removal. So key points are submandibular gland is the most commonly affected gland. Not all stones are visible on X-ray. MR sialography is a safe modern imaging alternative and best imaging modality. Treatment ranges from conservative to surgical based on the size, location, and symptom of the patient.